Welcome back to our panel discussion, Strategies for Effective Data Management in Government, sponsored by Veritas, here on Federal News Network. My guests today are David Scott, he's the Director of Product Management at Veritas, and Michael Sarich, the FOIA Director at the Veterans Health Administration. I'm your moderator, Tom Temin. And David, before the break, we were talking about this multimedia world that we're in, and that has a lot of implications for how you find things, what it is you're looking for, the whole metadata and tagging question, because you do have video, audio, chat, and afterwards the transcript, which is text, all of these different things. How does that affect how people classify, tag, metadata, and make things discoverable?
No, it's a great question, Tom, and it is a different. Like I think, as Michael said, it's an emerging space, and we're kind of running to catch up to some extent. There's a lot of great emerging technologies that help with this, and so we're looking at what we can do to enrich metadata around audio and video, so that if you need to do discovery against that content, you don't have to listen to an hour of video to find what you're looking for. In fact, you don't have to listen to any video. You can hopefully rely on the transcription of that artifact, so you can quickly jump to the place in the video that you care about. And I mean, this also leads to a lot of interesting other ideas. Like, say you're looking at body cam videos and you want to jump to a place where there's a scene of violence, an act of violence. Again, you don't want to look through the entire shift, 8 hours of video. You want to find the bits that are interesting. I was talking to a company recently that does image analysis, and basically they take that video and they look at every 100th frame, and they look for things that indicate violence, actions that they can do. And they've gotten very good at this. And that led to a conversation of, we do a lot of these videos where you see the close-up of the person's face. You can probably determine if they're bored, if they're excited, if they're engaged. Like, think of kids in school now. My kids, I've got two teenagers in virtual high school. And, are they actually paying attention is probably the critical piece there. And so then that also leads to some interesting other ideas like telemedicine. If I'm actually later today, I'm having a doctor's appointment, same thing, talking to the doctor over a video chat. Do I understand what they're saying? Is the doctor talking way above my head? Am I confused? Am I impatient? Am I an impatient patient? Am I angry that they're not getting to the point? Am I trying to get opioids? Am I trying to con them into thinking I have something that I don't have? All of these things make for very interesting analysis. And can we tell if someone is lying? Can we tell if there's a great rapport between a sales rep and a target customer? There's a whole world of new stuff that we can do with this, but there's the big brother aspect of it and the fear. And as Michael said earlier, you don't want to change the behavior of somebody because they know they're being monitored and analyzed. And I would think, especially with that doctor-patient interaction, there's all kinds of HIPAA red flags and things that just make it so that's extremely not possible. So just to kind of close on it, like, I think that there's different levels again. Like, maybe you want to learn from the video and then get rid of it very quickly. So, like, say again, doctor-patient interaction. Maybe we capture the doctor-patient interaction when it happens. Do some quick analysis. Is the doctor asking the right questions? Is there rapport? What is the key topic? Is this about diabetes? What's the diagnosis codes maybe associated with what's being said? That metadata lives on and is captured and available for the electronic medical record, but the actual video may disappear. The artifact may no longer be as important as all of the surrounding insight that we can get from that. And all of that surrounding insight can then feed into a broader data lake. Like, then you could maybe look at a correlation between the effectiveness of an individual doctor, effectiveness of that doctor's interactions with patients, and then correlate that to patient outcomes. That gets really exciting. But again, you've got to get over that privacy and big brother type mindset.
Sure, and that's just in the health domain. And Michael, does that ring true to what you're seeing in the way, in the types of data you're handling and the types of data you're getting requests for?
Yeah, absolutely. I mean, just on a broader scale, taking the data that we develop as an agency and leveraging that data to improve health outcomes for our veterans is critical. And it's something that we have teams of people doing award-winning work in the Veterans Health Administration in this very area to take that data and leverage it. And as we mature in our telehealth, just an incredible telehealth effort that goes on at the Veterans Health Administration with places, you can even go into, in some places, a Walmart and have a telehealth visit a safe, secure place for perhaps if a veteran doesn't have access to high-speed internet, and they can just go to Walmart, other locations where they can receive their telehealth visits. Kind of capturing that data and drawing inferences to improve the health outcomes of the veterans is critical. For our agency, they say the act of observing something, people being on video just changes it, from a social science perspective. And, I've got a kindergartner and a third grader, and the act of observing them while they're doing work, you can even tell how they change and either buckle up or slack off as I did when I was a kindergartner and third grader. And I'm sure as we all did. But when we're focusing on metadata from a FOIA standpoint, that really just enhances the discoverability of it, and it's going to then impact the user experience and kind of the quality of the products and the policy that our agency is going to create and what we're going to share with our public. We don't have the answers in our filing cabinet. It's not like we can say, oh, that meeting, go back in time and pick that out. Even when you YouTube a video, oftentimes it'll suggest the exact minute where you need to be in there. And that's a great time saver if you're doing a project. I just need to know this one little piece of information. I don't want to sit through the first 3 minutes of this, but from minute 3:02 to 3:17, it tells you exactly how to do that job, and then you're good to go. I'm sure all my fellow hairy homeowners, have that experience where they're trying to do a project and they want just that little bit of expert kind of assistance. But that enriched metadata is kind of, I go back to this a lot with, kind of paraphrasing Mark Twain. It's the difference between lightning and the lightning bug. That's just three little letters that are the difference between lightning and lightning bug. But if you're looking for a breakthrough in data retrieval, if you're looking for a breakthrough in a policy standpoint, you'd probably prefer lightning to just having some bugs. So that's where we're at here at VHA.
Yeah, so that has a lot of implications for how you handle the metadata in terms of not just what it is and it's stored away, but the discoverability and findability are also qualities that it needs to have, because once something's in a data lake, it's there, but it's a potential. So to turn it into something actionable, that requires some real careful work with the right tools, I guess, David.
Yeah, absolutely. And I mean, there's a number of different ways to approach it. You can do the transcription of audio and video to text. We also have a technology called Phonetic searching, which is very interesting. It's in our eDiscovery platform product. It lets you say what you're looking for, and phonetically it will look at the waveforms and find that content. So it's great because it doesn't get tripped up on homonyms, words that sound the same, different meanings, different spellings, that type of thing. There's pros and cons for both. And but at the end of the day, we want to help get to the relevant part. And to Michael's point, the idea of like looking for that phrase, looking for that bit that's relevant. Another capability one of our partners brings is the ability to kind of pull out the key topics that I keep repeating. Like in this case, this 1 hour video or 1 hour call, I might have said healthcare 5 times. It will show me down the right near the artifact, right near the transcription, the 5 times I said healthcare. Click on that and it'll jump to that point. Instant 1, 2, 3, 4, 5. And so it really aids in the discovery, supervision, speed and accuracy. You're able to jump to the relevant parts and hear that phrase being said without listening to the whole video.
And Michael, I would think for the FOIA function, that puts a lot of new pressure on FOIA officers, people that fulfill these requests, because you could decide, well, they wanted this particular lightning bug of information, and here it was 6 times in this 3-hour video, and you send the person 18 seconds of video. Whereas you could say, well, here's what they really might be wanting, and you could send them 3 hours of video. And that's making a judgment that could either be the right judgment, or it could be over-interpreting what you think the person wants, or it could be even used to kind of obfuscate or against transparency. So I imagine that's kind of a new pressure on how you handle all of that.
Well, it is in many ways with the new technology piece, but it also isn't, and it's also an older type of challenge. So, narrowly scoping a request to find out exactly what the person wants, especially in a media context, because you don't want to go through 10,000 pages of stuff if you really 10 pages gets it done. You think about the vast quantities of information that we have. That's a lot of potential energy, right? But you're looking for kinetic energy. You're looking for what will move the ball forward, for example, in a story or in a research project or whatever the case may be, or you're looking for a very specific piece of information. So we try and hone in on that. Now, that doesn't preclude us from doing things like discretionary releases. So in that case, with 18 seconds of relevant, data points in a 3-hour video, what would often happen in a case like that would be a good FOIA officer would say, here's the 3 hours, here's the 18 seconds that are most relevant to you, tagged here, here, and here. And you can look at the whole thing as a discretionary release, if it's publicly available type of video or federal record, I should say. And then they can make that decision from there. What we try to do to the greatest extent possible, where we have complementary records that we can do a discretionary release for, we provide those, because we really, again, FOIA exists to illuminate the operations of the federal government. Working at the Veterans Health Administration, we have an incredible story to share with the American people and indeed the world in terms of the care delivery that we're providing to 9 million plus veterans each month. And we're very happy to tell that story, right? Like, that's a great story. Like every agency and every business, there's areas for improvement, and that transparency helps drive improvement. So, we're always very happy to get that out and be as transparent as the 2016 FOIA Improvement Act dictates, the Holder Memo, which still holds, still relevant in our space. We're very happy to be as transparent as possible from that, and we'll often give discretionary releases. We'll often provide additional resources. We'll often point to other publicly available information. Our program offices do an incredible job of putting information out for people. So yeah, but you definitely can, if you were so inclined, which we're not, but if you were so inclined, you could kind of say, okay, well, you only wanted this, here you go. But that's definitely not a winning strategy for any FOIA program. And one, I wouldn't counsel any of my peers in the federal family to,
Sure.
to kind of engage in.
Understood. Now, we've been talking about video and large data sets and things that contain many data sets within data sets. But earlier we talked about capturing tweets and chats and instant messages and who knows, maybe even Instagram. A lot of agencies have Instagram accounts now, the visual agencies, the Park Service and so on. What are some of the issues with capturing those which are generated by just a multiplicity of mobile devices, and it's really easy to mix the personal and the official at the individual employee level? So what are some of the issues there in capturing and then also applying the metadata and findability factors to them? David?
Yeah, again, it comes down to volume, but it also, there's the idea that, this is my company phone, but I have non-company communication vehicles on it, and what's fair game to be collected and what isn't. I've heard of different strategies for that, like virtual phone numbers, so that you have a corporate number and a personal number on your phone, and that way your text messages and your personal calls use that number. And there's a couple of technologies out there that do that, and then that lets you collect all the company stuff and leave the personal stuff aside. But there definitely is that challenge. Like, what if you put in your personal Facebook account something that's very relevant to your job? I mean, there's a lot of, you can handle that with policy, but you don't have the ability to capture that unless it's publicly shared, to a wide audience. So there are some challenges there, definitely. I'm curious how, Michael, if you have strategies around that, or have you thoughts on that?
Yeah, sure. So you mentioned earlier the 2013 white paper that NARA put out on kind of social media and capturing those feeds or those posts or what have you. And gosh, when you say 2013 and it's 2020 and fiscal year 21, you just think of how the world has changed just in that blink of an eye, how much has changed in FOIA and in different apps that weren't even created because the person who created them was probably 12. And they've gone on to create, these world-changing, apps, TikTok and the like, and these apps that seem to constantly, come to the forefront of our culture. And so there's kind of a push and pull here, right? So one of the push and pulls is that, VHA, VA, federal government, we own our email, right? So we control that 100%. And, you get your work phone. You understand that it's your work phone. You understand that, anything you say can and will be on the front page of the Wall Street Journal, at any point in time. So you understand that. But what comes into play a lot is the limited personal use. So for example, on my lunch break, if I want to go on a retailer, it's Prime Day or something, and I want to go pop on, no big deal. Limited personal use, not an issue. Go for it. Don't mind if any of my employees do that. no one cares. But then it's 10 o'clock at night and you're mad because you just read something and you fire off something, and you just happen to, you've seen this time and time again, where the person who owns maybe the United States Navy's account thinks they're posting on their personal account, but they hit the wrong button and they're posting on the Navy's account, and then they got to do a hasty retraction. Oh, that's a Turkish battle flag. Don't look at, don't take these things down. This is an international incident. So, kind of drawing that line. And I think that's difficult for people in our 24/7 always on work culture. I mean, I work very often, probably far too often, very late at night, and many people do. And just the fact of COVID and the fact of, I've got to take care of this thing with the family, so I'll put this to the side and take care of that when the boys go to bed or something, when you have that time. And maybe you're not in your right, state in terms of where you would think if I was in my office, you'd have one point of view, but you're not. You're in your house, and you have a different point of view. It's just a reality. So, that kind of push and pull. So basically the strategy overall is that we would never, as an administration, and certainly I think as a government, we would never just put something on one channel, right? So we would never put an official document just, on an omni-channel basis on Twitter or Facebook or, fill in the blank social media site. We would have official backups for that, so we could refer back to those. But yeah, it is a real challenge, and I feel for the guys and gals out there, the public affairs folks that are so in tune to the digital age, and they've got all kinds of apps, and they've got 6 burner Twitter accounts, and they've got this, and they don't know, keeping those things straight. I'm glad that's not my role, but we do caution people, colleagues, friends especially, to be very cautious in that space, because again, when you're always on, that means you're always accountable. And if you're accountable, then there are consequences for your actions. We all love our First Amendment. It's the freedom to speak. It's not the freedom from consequences for that speech. So we just kind of take it from there.
All right. On that note, we will go to a short break. I'm your moderator, Tom Temin. This discussion is Strategies for Effective Data Management in Government, sponsored by Veritas, here on Federal News Network.